Perfect. Well, we're thrilled to have you join us for another webinar in conjunction with Medical Device HQ. Our previous webinars focusing on risk management, software as a medical device, and internal auditing were extremely successful, and I'm delighted to see participants who attended those webinars along with new faces here today. So, following introductions, today's agenda is going to be centered around a presentation by Christian on why IEC 62304 is changing, what's happening behind the scenes, what the new edition means for SAMD and AI companies, and how the changes will impact your organization. We're then going to hand over to Colin in the Qualio product team, who'll be running you through something we're very excited about at Qualio, a new AI-powered compliance tool that transforms how you meet your compliance requirements for standards like ISO 13485 and IEC 62304. After that, you'll have the opportunity to ask Christian anything you'd like regarding IEC 62304 through the Q&A chat box on your screen. I encourage you to post questions while Christian is presenting, as he'll respond to them as he discusses the various topics. I'd ask, please, that you keep your questions as generic as possible so that everybody attending actually benefits from the responses. Also, because we received several questions in advance, we may not be able to get through all of them in our 1 hour time frame. But don't panic, because Christian will write LinkedIn posts to cover the unanswered questions, and I encourage you to follow Christian on LinkedIn to continue the discussion. So now we'll move on to the introductions. I'm Lola, a senior quality success manager at Qualio. Before joining Qualio, I worked in quality and compliance roles in large multinationals and startups across Europe and North America. And I use my prior experience in EQMS implementation to work closely with customers in Qualio so that they achieve their quality goals and bring their product to the market more efficiently. I'm absolutely delighted to be joined again by Christian Kaestner. Christian has over 25 years experience in the medical device industry with deep expertise in software development, project management, quality management, and regulatory submissions. He's also an active member of the IEC 62304 authoring team and a highly regarded trainer at Medical Device HQ. Before I let Christian introduce himself further, let me tell you a little bit about Medical Device HQ and how it can make you more confident in the development of your medical device. So the company was founded by Christian's colleague Peter Sibelius in 2008, and it offers training and expert resources to help teams bring medical devices to the market efficiently and with confidence. What makes their courses stand out is that they're created by ISO and IEC standards committee members, and there's a strong focus on practical application. They also offer fantastic resources in the form of articles and YouTube videos, and I recommend you checking out the Medical Device HQ YouTube channel. Their training courses cover a wide range of topics, ranging from risk management to software as a medical device, which I've taken myself and are excellent, along with many other key areas like clinical trial investigations and design controls. Christian also recently developed an excellent course on agile medical device software development, and it's received great reviews to date. You can take them online in blended formats with live sessions, and now also through your company's LMS. We'll include a link to all of the courses offered by Medical Device HQ in a follow-up email after the webinar.
So thank you, Lola, for the introduction. To avoid seeming too nerdy, I just want to share a more human side of myself as a starter. I have 3 adult children, 4 cats, 4 beehives, 15 hens, and I love gardening. So now you know everything about me. So let's continue. Back to my nerd side, and what could be better than starting with a disclaimer? Well, first of all, this is not an official IEC presentation. It's my perspective on the ongoing work, and I'm one of 71 experts on the project team. Even though I haven't asked my 70 colleagues, I believe today's presentation is a fair summary of the current status. I would say we are roughly around 20 experts actively involved in the work, and it's definitely a team effort. Before we discuss the upcoming changes in the second edition, I want to share the reasons behind these changes, because that could be worthwhile knowing. I also want to provide insights on the behind-the-scenes process involved in developing standards. The first version of IEC 62304 was published in 2006 to meet regulatory expectations for standardized guidance on software development. In 2015, the standard was amended to include guidance on, basically managing legacy software. And the idea with the introduction of the legacy clause was to help manufacturers bring products developed before the establishment of the standard into compliance. Additionally, there were minor changes to the software safety classification aimed at helping manufacturers manage the classification process more effectively, rather than consistently ending up in Class C. Well, whether that worked or not, that can be debated, but let's leave that for now and look what happens next. For the edition 2, a major change is the scope shift from medical device software to health software. This adjustment is made to fully align with IEC 82304-1, which is the product standard for standalone software, often called SAMD or SAMD, or software as a medical device. There will also be a simplification of the software safety classification by reducing the number of levels from 3 to 2. Lastly, considering that the current version is nearly 20 years old, I expect the new edition to include a level of modernization to reflect today's state of the art. I haven't seen an updated timeline for the project, but I'm guessing, or hoping perhaps, it will be finished by 2028. It might be as late as 2029. So let's keep our fingers crossed that we will hopefully finish it by 2028. For those unfamiliar with the standardization process, here comes a short summary, just a brief overview. It begins with a working draft, which is often referred to as a new work item proposal when it involves the creation of a new standard. It is worth noting that there was a previous attempt to develop a second edition of IEC 62304. Unfortunately, this effort stalled due to challenges in achieving consensus among key stakeholders. We spent quite a couple of years and it still failed, but okay, that's part of the game. However, an important outcome of that previous work was a design specification that now functions as a working draft. This specification has guided the development of the first committed draft and would continue to inform the project moving forward. Although not all national committees are happy about the design specification, it has gathered a majority acceptance, and the project team is keen not to deviate too much from the specification to avoid yet another stopped project. So here is a summary of the key guiding principles for the project team. As mentioned earlier, the scope will change to health software, which is broader than medical device software. 3 levels will change to 2. You can say that level 1 will correspond to Class A, more or less, and level 2 will probably be a merge of Class B and C. IEC 62304 is a process standard that relies on other standards for product relevant requirements. And this will be clarified and emphasized in the second edition. And that is not all. Here's more. Due to the scope change, normative references to medical device standard is not an option any longer. The legacy clause has to some extent been used to cheat. Sorry to say that, but some try to cheat with standards and regulations. This has resulted in suggesting moving the clause to an informative annex instead of keeping it as a normative text in the standard. State of the art expects some level of architectural planning for all levels. In the past, Class A has had more or less no requirement, or has had no requirements for architectural planning. Annexes shall be developed to cover relations to other standards and modern technologies, including AI and Agile. Then you can, of course, argue whether Agile is a technology, but I hope you get the point. Well, after the webinar, I'll show you get a link to the design specification because it is publicly available at the IEC website, so that will be shared to you in email after the webinar. With the help of the design specification, a CD, a committed draft, was developed and sent out for commenting earlier this year. Together with the CD, a change rationale was provided to explain the changes being made. I've selected a few key topics addressed in the document, and I will also revisit several of them shortly and explain them in more depth. The classification will be called process rigor level, and the criteria for the determination will change. And the reason for that is that basically, as I said before, it is a process standard, and what you determine is the rigor of the process you shall apply when developing software. In the past, software safety classification has been misunderstood as determining how safe your software becomes. And that's not the point. It's more about determining the rigor of the process you apply. New requirements for AI planning will be part of the second edition. Clarification on supporting items to be controlled. Simply put, you must control whatever items needed to recreate the software. Whether that is compilers, test tools, or source code, it's up to you as the manufacturer to determine and identify what items are required to rebuild or recreate a software. The current version has some requirements for communicating with users and regulators. This is typically a product requirement and will be replaced with a requirement on planning what information shall be communicated to whom and when. And well, the reason is that perhaps if you're familiar with the current version of the standard, since it's a process standard and not relevant for products per se, it is a bit awkward that the standard requires you to communicate, for instance, with regulators and users because they are kind of disconnected to the standard. Well, I will come back to that shortly again. There will also, in the change rationale, there is a justification for architecture requirements for all levels. However, there will be differences between level 1 and level 2. The maintenance clause has been revised to clarify product level versus software development level. And guess what? Also, the change rationale is publicly available on the IEC website. And also this link will be shared with you after the webinar. So enjoy the reading. Well, then, despite the brilliant change rationale document, the first CD received numerous comments, which will result in a second CD. Hopefully it stops there, but you never know. There might be even a third CD, and hopefully not a fourth, but let's see. After the committee draft stage, there is the committee draft voting, final draft international standard, and international standard, then following the committee draft stage. It can all be summarized as draft, arguments, more drafts, final compromise, because after all, it is kind of a final compromise. But let's leave future stages for upcoming webinars. I might be allowed to come back and stay focused on where we are today in today's webinar. The first committee draft generated nearly 1,500 comments, each which requires a response with a resolution of either accepted, partially accepted, not accepted, noted, or defer. Trust me, it is quite a lot of work. To make it more tangible, here's an example in our worksheet where we manage the comments. And this comment is about requesting that ISO 13485 and ISO 14971 remain normative, or even says must remain normative. If you listen carefully before, this will not happen due to the scope expansion into health software, making the suggested change inappropriate, because in the health software domain, we can't expect all manufacturers having ISO 13485 or 14971 compliant systems implemented. However, in this particular case, the comment is not rejected, but accepted in principle, as CD2 will require the existence of some quality and risk management systems. However, no normative requirement for the standard, hence partially accepted. This is an easy example, but among the 1,500 comments, there are many challenging comments. So here comes my winding slide, because I want to share the scale of work being done behind the scenes by putting numbers on the work being done. Assuming 3 experts spend an average of 5 minutes on dispositioning every comment, they would in total spend 47 workdays. My lovely wife would probably say 3 experts can lose 47 workdays just arguing over commas. Obviously, we are far more professional than just discussing comments, but some discussions can take a considerable amount of time to resolve. Some more numbers. If 500 comments are accepted to some level and it takes 10 minutes to implement, someone would spend 10 workdays doing so. And trust me, it takes longer because there's a risk of introducing conflicting changes. Well, enough about the whining side. My point is it takes time and considerable effort to develop standards. That was the first part about behind the scenes and the reasons behind the changes. So Lola, do we have any questions before I proceed into the next section?
Yeah, we've had a couple come through. I've picked two that we can answer now and then save the rest for later. So somebody asked, is harmonization with the EU MDR also a reason to change the standard?
Not really. It's a challenging question. Harmonization in itself is a challenge. But I would say no, that's not the main driver as far as I've heard.
Perfect. Okay, thank you. Somebody was just looking for some clarification. They're wondering, is this new revision only related to health software, leaving behind medical device software?
Medical device software is included in health software. So health software is a broader concept. And medical device software is part of health software.
Fantastic. Thanks for that clarification. I'm going to save the rest for our Q&A session.
Sounds like a threat. I hope not.
All good.
Oh, good. So perhaps now a topic some of you have been waiting for, SAMD AI, and what will happen? Will there be a revolution? Well, sorry to say, don't expect a SAMD revolution in the second edition. SAMD, SIMD, cloud or embedded, it's still medical device software. And IEC 62334 cares about the process, not the acronyms or type of software you're developing. Now you might wonder, if IEC 62304 doesn't make a difference, where's the distinction between different software types happening? Let me share a few slides from a SAMD course at Medical Device HQ to shed some light on the topic. I typically divide standards into three groups: product, process, and management standards. The management standards are process standards or group of process standards applicable to all kinds of medical devices and include quality and risk management standards. In a process group, you find standards relevant to the product you're developing, which vary depending on the product. If we assume software is part of a medical device, I would expect to see standards covering areas such as usability, software, and security. Please note that at this stage, there's still no significant difference in the type of software you develop. At the product layer, it matters whether it's a SAMD or SIMD, as this would guide the choice of standards. If you're developing a standalone software SAMD, your go-to product standard is IEC 82034-1. If you're working with embedded software or SIMD, software in a medical device, the product standard is likely IEC 60601-1 or perhaps IEC 61010-1. However, being 20 years old and written before SAMD, cloud, and AI, the current version is biased towards SIM terminology and examples, and I think that's excusable given the age of the standard. Still, the intent is to cover any medical device software, and as it's being revised, the language and examples will be updated to modern standards. But still, don't expect much specific focus on SAMD in the second edition. I hope it makes sense. Otherwise, you can fire away the questions in the chat window or Q&A tab. Now, let's turn to AI in the second edition. What will happen? The first CD featured a detailed clause on AI, but it received many negative comments, resulting in most AI-related content being moved to annexes. And partly the reason for the negative comments was that there are other standards being developed currently, and there's a risk, or well, I would say risk, of overlapping standards, and we don't want to have too many standards more or less saying the same thing. And the problem then is if they are redundant, they might not say exactly the same thing. But let me get back to what will happen onwards. The normative text will likely only include a simplified clause on requirements for AI planning if it's incorporated into the software system. And here I think it's also worth mentioning that there's a big hype today. I hope I'm not treading on anyone's toes now when I said there's a hype on AI, but not all medical device software will include AI, and probably just a fraction of all medical device software product out there will incorporate AI. So I think that's worth keeping in mind, and that's partly also why there will not be an AI revolution within 62304. The annexes will be updated and describe quite a lot about AI and also point in the directions of standards currently being developed, given we have a couple of years before this standard will be finalized. Well, hopefully there will be other standards pretty well well, close to being released as well and published as well. In the future, I expect there will be AI-relevant process standards which could be included in the process layer. And then you can tailor your set of standards to meet your development work. So it's basically you pick and choose the standards needed to develop your specific product. So that was AI and sound. I hope I didn't disappoint too many people, and I hope it made sense what I explained with process versus product standards. So Lola, do we have any more questions?
We sure do. They are coming in. So I'll pick another two that we can focus on now. You mentioned briefly there when you expect the standard to come in, hopefully in the next few years. We've had someone ask, do you recommend to start the preparation for version 2 implementation in their QMS now?
I will come back to that in the next section, but basically, yes. And the quick short answer to that is, if you are in Class B, I think you should start looking at what's required for Class C.
Okay, fantastic. And as you said, you're going to come to that again shortly, so that's great. Somebody else has asked, is there a risk of loosening requirements by broadening the scope to health software?
I mean, yeah. I believe some assume that it would become easier. The problem is it would be easier because it is a safety standard. So no, we will not loosen requirements. On the contrary, I think we will actually add requirements.
Okay, fantastic. I'll actually sneak one more in there. Somebody wants to know, will the FDA implement the next edition as a recognized consensus standard? Would you know that?
You tell me.
Okay, I tried. Sorry to ask that question.
We'll put it this way. Our convener, he is from the FDA, so I sincerely hope they will.
Fantastic. Okay, I'll keep the rest for later. Thanks a million, Christian.
Yes. Okay. What would change and how it impacts your organization? And perhaps some of you have already started to think about that. But let me share a couple of perspectives on what will, how it will impact you, basically. And to this, here's a pre-submitted question. So has something changed to the software safety classification? Have the requirement activities and documentation related to different classes been aligned with the documentation requirements in the FDA guideline? I stopped there to catch my breath. This is actually two questions in one. So yes, there are changes to the software safety classification, as already mentioned. And no, IEC 62304 is an international standard and is not aligned with any specific regulation or guidance. That said, it's not a hostile activity saying we shall not align with FDA. That's not the intent. But since it is an international standard, we can't really focus and narrow down on a specific regulation or guidance. And on top of that, the FDA guidance is there for a different purpose. You can say the FDA guidance identify what documentation or information to provide in a submission, while 62304 is about the process you shall apply to your development work. So they serve two different purposes, and that's partly also why it's not possible really to seek perfect alignment. Hopefully, however, the process you apply following 62304 will result in the documentation required or expected by the FDA guidance. Let's take a closer look at the classification. As mentioned before, 3 levels will become 2. And essentially, this means that all software products developed in conformity with the current version of IEC 62304 must undergo a reclassification because the rules will change and you need to, redo your classification. However, I hope it will not be too complicated to do that. As mentioned, the rule will also change. So how do you determine what is what? It's not only change from 3 to 2 levels, but the classification rules are changed in a way that we focus less on serious and non-serious injury, which has been the key focus in the past. Now the broader term harm is used throughout the classification work. Your software system may become a process rigor level 1 if it's very unlikely to contribute to the occurrence of harm or only negligible harm can occur. And as I have once again, I have a disclaimer. Please note the exact wording may change, so don't get too upset or hung up on the wordings right now. It is work in progress. Now, I have two more pre-submitted questions, which I think relates to this. So this question is, can I still reduce the software safety classification then in the future process rigor level by hardware measures? And yes, you can. It is still accepted to consider external risk control measures. And this is basically, I would say, this is good risk management. Because if you implement risk control measures outside of the software domain, well, then probably the software can't cause any harm any longer. Consequently, it's reasonable to reduce the process rigor level accordingly. This is longer. Will a requirement that the probability of occurrence of software events can be estimated and must be set to 100% still exist in the next version? And do you still support interpretation, which Christian, and by the way, thanks for putting me on the spot, presented in another course on IEC 62304, that this probability, I need to read again, that this probability of occurrence can be reduced with risk control measures. And also here, I feel I must provide two answers to this question. So regarding if this question is related to process rigor level determination, it is rephrased slightly. So we are talking about defects, and that the probability of defects is 100%, but the likelihood of failures can be lower if justified. And I will briefly explain the relationship between defects and failures, but first a more general response to the question. From a pure risk management perspective, I have not observed any changes that prevent the probability of occurrence from being reduced through risk control measures. However, if risk control measures are used to lower the process rigor level, such risk control measures must be external to the software system being evaluated. So in general, yes, I think you can still reduce the probability of software failures by implementing risk control measures and perhaps also working with a good software architecture. Now, let's return to defects and failures. Due to the complexity of software systems, we must assume that it contains defects. And sorry to say, I'm a software developer myself, and I hate to accept, yes, I have developed bugs, basically. But that's the way it is. Defects can be described as undetected bugs or sources of failure. While we assume defects exist at 100% probability, this does not mean failures are also at 100%. Because think about it, before releasing software, I hope you test it, and most likely your test shows 0 failures. So, well, then it's kind of awkward to say the probability of failures is 100%, because obviously it's not. However, your tests don't provide much information about how many remaining defects may still be present in the software. And that's part of the problem. The probability of defects manifesting themselves as failures is referred to as P1 when you work with risk management. Perhaps you're familiar with P1 and P2 concepts. If P1 cannot be quantified, it should be assumed to have the highest probability, meaning basically the worst case. And this is then, unfortunately, still 100%. If you have evidence supporting that your IEC 62304 development process consistently delivers software with low occurrences of failures, that is an indication that the number of defects is low and hence could be used to claim a P1 less than 100%. However, if you don't have supporting evidence, you should assume the worst case scenario for the process rigor level determination. If you're not familiar with P1 and P2 in risk management, check out my video at Medical Device HQ or at the Medical Device HQ YouTube channel, because I think if you work with software and haven't seen or haven't heard about P1 and P2, I think definitely it's worthwhile spending 7-8 minutes watching that video, because it will be helpful to work with, in general, software risk management, basically. So head over there, not now, but later. I guess some of you feel this is abstract and perhaps even hard to grasp, and perhaps I'm too fast in my explanation here. But rest assured, the annexes will be updated, and the project team is investing time in explaining the reasoning behind the process rigor level and how to work with the terms like worst case, unlikely, and negligible harm. In general, my take is that it will be more straightforward approach compared to today's software safety classification. Now, let's take a look at how I foresee the impact of the classification changes. Unless you're already in Class C, the new classification system will affect you. If you're in Class B today, I recommend you start, as per previous question, you start reviewing today's Class C requirements. But I will also say, don't worry, don't rush. It will be a couple of years before the second edition is published, and there will most likely also be a transition period. Still, I think you agree that there's no harm in being prepared, right? So if you're updating your software development procedures, well, it looks like the bar will rise and Class B and C requirements will be merged. So tough times is coming. Due to the scope change to health software, more products will now fall under IEC 62304. This could mean that products not currently developed in accordance with IEC 62304 should possibly do so in the future. But however, I doubt we will see any regulatory enforcement on applying 62304 to non-medical device products. So this is more for you as a manufacturer to decide whether you would like to apply 62304 or not. Then there's an interesting intersection. So the updated rules create an intersection potentially elevating some Class A devices to process rigor level 2 because of the use of harm instead of serious or non-serious injury. Because it's basically a broader concept. It could also go in the other direction. If your assessment has been too strict, the wording unlikely and negligible harm might work in your favor, allowing you to lower your classification, which I guess some probably would welcome. But please don't cheat now. That's not the intent. So it could basically go both ways in this intersection. So when you hear level 1 will be equal to A and level 2 will be equal to B and C, well, there might be a gap in the middle you should watch out for. So here is a couple of more, or at least one more pre-submitted question. So will there be a transition period? And is that period expected to be recognized globally by regulators? This is, of course, a good question. And I don't know, to be honest. It's not for IEC or the project team to decide. It depends on regions and regulations. But to the best of my knowledge, there is always, or usually, some kind of transition period when standards are updated. I would expect that transition period to be like a couple of years, 3 to 5 years, depending on where you are. So if you think about what I said before, I recommend you start watching, well, perhaps preparing yourself. If we assume the standard gets published in 2028, if we are lucky, and on top of that, you can add 3 to 5 years, there's no rush to prepare yourself, but it's always good to keep in mind that there will be changes. I have, well, this is getting close to the ending of my presentation. So one last slide about general things that will change. Well, there will be requirements, or put it this way, the bar will rise for all levels. Then there will be requirements to document methods for verification. And this is kind of broader compared to before. It asks you to plan in more depth than before. Static code review is now an explicit requirement for process rigor level 2. Some architectural requirements will be required for all levels, of course, all for level 2, but some basic, well, architectural requirements will be there for also for level 1 to reflect the state of the art of today. And the last one, there will be a requirement to document the level of independence. So independence is acknowledged as a good safety measure. However, 62304 as it stands today will most likely not specify the expected level of independence. That's basically for you to identify what you find meaningful. So I will pause myself, and if you have questions, please use the Q&A chat box and post your questions there. And then I hand over to the Qualio team for a demo, and see you after the demo. Thanks for now.
Perfect. Thanks so much, Christian. So we have loads of questions that have come in that I can't wait to get to after this demo. So for us at Qualio, The IEC 62304 compliance challenges that we've discussed today aren't just something for medical device software companies to think about. As an EQMS provider with hundreds of medical device and SAMD customers, understanding where regulatory professionals are being challenged by regulatory compliance and how to alleviate that burden is a critical part of our product development roadmap. We've therefore been considering these challenges and working on something very exciting to share with our current and future customers, which we launched only 3 weeks ago. So here's a quick teaser before we get into the questions from Qualio from Colin in the Qualio product team.
Hello, and welcome to the demo of Qualio's Compliance Intelligence tool. Purpose-built for life sciences to transform compliance from a bottleneck into a growth accelerator. Our AI-powered platform is designed for the regulatory aspects of life sciences, automating gap analysis, unifying multi-standard compliance, enabling continuous audit readiness, reducing cost, eliminating surprises, and helping you scale into new markets with confidence. Starting off, we have our library of life sciences specific frameworks. These are the frameworks or requirements and regulations and standards that you need to adhere to. A few examples here: 13485, 9001, 17025, ICHQ 9, ICHQ 10, etc. And we were continuously building out this library of standards or frameworks, and they're built by our internal SMEs and validated by external experts. If we jump into a given framework, these compose of requirements, which are the requirements that you need to adhere to, 4.1.1, and the requirement is here, as well as controls. And controls are how we recommend that you meet a given requirement. And you can see here that there are a number of different controls against different requirements. And within a given control, there are two aspects of a control. There is the process definitions as well as the objective evidence. And in this case here, we're in the management review control, and we have a number of process definitions here. This is how this process is defined, and we have both templates as well as SOPs. The objective evidence is the output of those processes. So this is the management review report, and you can store these here. Controls can be mapped to multiple requirements across multiple frameworks. So once the work is done once in a control, it is done and can be reused in those other areas. We have further automation here with what we call fetch. And this is where we scan your QMS to try and find relevant policies, procedures, work instructions for this given control. And in this case, you can see here where AI has returned, it will be marked with this symbol. Where they're added manually, the symbol won't be there. So this is set up to give you an example of how it looks in both cases. We also scan that information for what is relevant from it, because in some cases there might only be a small aspect that is relevant, and we will show you that in a table of relevancy so that you can review yourself, giving you more transparency and insight into what the AI is doing. You can then assess your definitions. This will check these against the intent of the control as well as the map requirements, and if there's any issues, they will be raised as gaps. You can review these gaps and decide what you want to do. You may want to dismiss, resolve them, or you can review further with our AI remediation agent, where you can ask more questions to understand maybe more detail about what is happening or different options for how to resolve. Within your objective evidence, you can store these here as well. And again, you can assess your evidence. Now, in this case, your evidence is assessed against the rules from your policies, procedures, and work instructions. And again, for transparency, these rules are visible here. So you can see which documents or which aspects of the definitions the rules were extracted from and what the rules were that you were assessing your evidence against. Okay. And then in terms of collaboration, you can also assign ownership. So you can see here that I'm the owner of a number of these out to different members of your team. Austin is the owner here, so that you can distribute the ownership of your compliance work across your organization. And we also have the ability to create tasks. So if I jump in here, Within our complaint management control, again, we have our SOPs and we have some evidence here, and we've got a couple of gaps. Now, associated with one of these gaps, we have a task, and that's to revise SOP 17, customer complaints, and it's assigned to Austin. He's a little bit behind on this one in case it is in this demo, and I need to get on to Austin, but he will receive this in his dashboard, and there is a task for him to update the SOP. And once he has completed, he can complete that task, and then we can revise the gap and resolve and close if necessary. So it allows you to have a collaborative area to work through your frameworks. We have the status and requirements, so we see how many we have met versus in progress or attention required. At the framework level, we can see all of the gaps, and we can order them by severity so we know where to focus, and we can list all of the tasks associated with this framework as well. And this operational efficiency, this efficiency gain that you get from collating, organizing, an assessment can be reused to then resolve those gaps, reducing risk and putting you in a stronger position ahead of any given audit. Now, going a step further, we can also go into more proactive, continuous compliance. And that's where we move into our monitoring state. Now, within monitoring, what we can do is, for example, within supplier management, if we look at this, if there are any updates to any policy, procedure, work instruction associated with these definitions, in the monitoring state, these will automatically be picked up and a gap assessment will be run. If there are existing gaps and that change is going to close one of those gaps, the gap will automatically be closed with traceability, or if there's any new issues found with that change, a gap will be created and you will be notified. Additionally, within the evidence, we can set up what's called monitors. And monitors allow you to set up rules. So in this case, we have two rules. One is any supplier that's created will be gathered here. And you can see 3 suppliers here, or any document of supplier periodic review will also be collated automatically when it is created, and it will automatically be assessed. Again, any gaps that are found, you will automatically be notified. And in this monitoring state, as you can see, changes to your definitions and our new evidence are automatically picked up. You don't have to organize and collate these yourself. They're automatically picked up, automatically assessed, and you will be notified of any issues if there are. That puts you in a very proactive state where you have the ability to work across a lot of activity that you otherwise wouldn't be able to do manually. So all of this combined gives you your centralized compliance view, where you can see the standards you're working towards. In this case, we're implementing against 3 of those standards. You can see how much progress we have made in terms of our implementation at a high level, as well as any we're monitoring against and how well we're doing in terms of monitoring those standards. This brings a lot of operational efficiency, which I said, that can then be reused in terms of proactively resolving issues, helping you to get into a very confident compliance state more quickly, allowing you to achieve market entry or certification faster than you otherwise could. So thank you very much, and that covers the demo of our compliance intelligence tool.
Perfect. So we can move back to the chat now with the final few minutes that we have. So Christian, there's been great discussion back and forth in our chat box about this. So I'm going to ask you, the question that was asked originally was, I don't understand the difference in intent behind health software and medical device software. When is software a health software and not a medical device?
Thank you for that easy question. Well, put it this way, regulation varies between different countries and regions, and that has made in the past, in some regions it is a medical device, in some regions it's not a medical device, then it's just health software. And that I've been told that that is one of the reasons to move away from just saying medical device software to make the standard applicable to regions worldwide, where there might be differences in some regions saying this is a medical device, this is not. However, to be honest, I find this still quite a strange explanation, because it's voluntary. You can apply 62304 if the scope is medical device software to all types of software. So unfortunately, I don't have any really good answer to that. I've been looking for that myself. The project team has been tasked to change the scope to health software, which is a broader term, and that's what we're doing. That's basically what's in the design specification as well. So sorry for not giving you really good, brilliant answer to this, but it's a scope extension. It's broadened, and that's what it is. So sorry.
Thanks, Christian. It's great to get your opinion on it, because it's been probably one of the most talked about things in the chat since the presentation kicked off. The next one I have for you, in the presentation, you stated that if risk control measures are used to lower the process rigor level, such risk control measures must be external to the software system being evaluated. So we had someone say, is user training considered as external, an external risk control measure?
I would say no, and no, because have you worked with a doctor, and do you trust the doctor then afterwards? Probably no. I'm not saying that because I don't like doctors, but the problem is you need to prove that will also be additional requirements in the second edition, that you need to prove the effectiveness of those risk control measures. So you need to justify it, and you need to provide evidence of those risk control measures being effective in lowering the risk. And using user training, it's most likely hard to provide evidence that that training is really, really lowering the risk. If you can, feel free to do so. But my go-to answer is, unfortunately, no.
Okay, thank you, Christian. Another one that came in, on the last slide you spoke about the things that are going to change in this new revision. And we had a few people ask, could you clarify the independence concept? What is the level of independence?
Well, currently it looks like it will be up to the manufacturer to determine and decide what level of independence will be needed or required. So the only thing we currently have in the standard is a requirement is to ask manufacturers to explain the level of independence achieved. So that could be you working with colleagues not working on the project. You can go external if you would like to. You have some external kind of implicit requirement in the security standard for using external labs. But that would currently not be a requirement in 62304. It's more like I shouldn't code, test, and deploy the software myself as a single person. It is valuable if you could have a second pair of eyes, or we have 4 pair of eyes looking at what you do. So it's more encouraging to implement some kind of independence in the work.
Fantastic. Thank you, Christian. So someone has asked, do normal people like me who are not part of the IEC standards committee, do we get to view the comments, those 1,500 comments from the drafting stage?
You don't want to. Well, usually not. You could get in contact with your national standardization committee and perhaps ask a copy. I'm not allowed to share and publicly share those files. But I would say get in touch with your national committee and perhaps meet with a person there, and they can probably share the information.
Okay, great. So it's great to know that it's just not widely available on the internet for anyone to look at.
Unfortunately, I think it would be great, but it's not.
Okay, thank you. I'll move on to another one. So we had a set of questions that came on this. Will the new revision of IEC 62304 include and then eliminate the 82304 standard?
No, they serve different purposes. So 62304, as mentioned earlier, is a process standard intended to develop any type of software. And there are no requirements in 62304 to validate the final product, for instance. And there's no requirement in 62304 like how to label and, create an instruction for use, a company document in any case. And that's where 82304 steps in as a product standard with validation requirements and documentation requirements on how to document the product, the final product. So that applies to SAMD. And if you instead work with a SIMD or medical device included in or embedded software, well, then you go to the 60601 standard probably for that type of information. So there will not be much of the two standards. The intention is that they should serve different purposes.
Okay, great. Somebody on that just asked then, will the new revision have more links then to the IEC 82304 standard?
I don't think it will have more links, but the links between the process, well, the software development process and the product layer will be clarified. So we'll try to work pretty hard on clarifying, well, the information exchange that will happen between the software development process and the product layer. So,
Okay, fantastic. I will try get one or two more questions in before we wrap things up. Somebody has asked, can we expect any change following the upcoming updates to the 6601 standard?
Oh, I prefer not to get that question now.
Okay, no problem.
No, but put it this way, that's two parallel projects going on, and that's quite a lot of overlap in the people working in both projects. I hope 62304 and the PEMS chapter in 6601 will kind of get closer to each other, so we avoid redundancy between those two standards. I think that would be great, and there are some efforts spent in the background to trying to achieve that. But let's see how far we get.
Okay, thanks for answering that, Christian. Someone asked, an update failed in the past. Is there a consensus now that this one is going to go through?
You tell me. No, well, as I mentioned earlier, the design specification was a summary of an agreement which all stakeholders agreed on when the second or the first attempt failed. And that design specification has been circulated to all national bodies, and there is a majority vote. So as long as we stay within the design specification, I definitely expect that this project would come through.
Okay, that's great news. Fingers crossed.
Yes.
I'll finish on one last one. So, can you define what is meant by a static code review? Does it mean a review by humans or a static analysis tool?
It's a static analysis tool, you could say, or static analysis. Then whether you use a tool or whether you would like to do that manually, could be kind of up to you. But as I think probably I misspelled it. I should have said a static code analysis. That's the study, and I usually see that as a tool being used.
Okay, thank you so much. We are coming to the end of the webinar, so I'm going to start wrapping things up. As I mentioned to everyone, don't worry, any questions that we didn't get to, Christian will answer in LinkedIn posts. So if you haven't connected with him already, please do after the webinar, on LinkedIn that is. So thank you so much everybody for participating, and I hope you've all learned something new today. The session has been recorded and it'll be emailed to you soon with lots of extra useful resources, including a link to the Medical Device HQ courses and also a short survey just to get to your feedback on how you found this session, and we'd really appreciate you completing that. I want to thank Christian for his time and answering your questions today. Christian, is there anything that you'd like to add before we finish?
No, thank you for joining, and I appreciate all questions. And if you have more questions, well, connect with me on LinkedIn, and I'm happy to keep the dialogue going. Thank you.
Perfect. Thank you so much, everyone. See you again.